Well, hello and welcome to the 27th Degree with Chris and Nancy, being broadcast from the BioSkills of Northeast studio in Fall River, Massachusetts. Today, we'll be discussing allergies with Dr. Joseph Zhou. Before we begin our conversation, however, I'd like to thank our sponsors, Baycoast Bank. Baycoast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. And Duncan Hearing Healthcare. Hearing healthcare you can trust with sites in Fall River, Dartmouth, Falmouth, and Centerville. For more information, visit their website, duncanhearing.com. As always, you can support the 27th Degree with Chris and Nancy by subscribing to us on YouTube or your favorite podcast platform, and by following us on Facebook and Instagram. Also, please remember to leave a review, and of course, 5-star reviews are always greatly appreciated. Dr. Zhou, thank you so much for being part of this today and speaking about allergies. Maybe you could start by just telling us a little bit about yourself and what an allergist does.
Okay. I was practicing medicine in China for more than 10 years.
Okay.
Before I pursue my PhD degree in nutritional science.
PhD, okay.
Yeah, and then did many years research before I came back to the clinical medicine.
Okay.
So I did my allergy training at the Children's Hospital Boston.
Great.
Nice.
Our facility.
Yeah, and then worked for the Boston Medical Center for about a year, or a little bit more than a year, before I moved on to the private practice. So the allergy, we do a lot of things: food allergy, environment allergy, medication allergy, all kind of allergy issues. But today, we probably just talk mainly about the food allergy.
Right. I think we could spend hours if we were going to talk about everything. So we'll start off, of course, with food allergies. Nancy, why don't you go since you're eager to?
Really?
Yeah, go
You're
ahead.
giving me a chance to ask the first
Yes,
question?
go ahead.
I'm very excited. Dr. Zhou, when we talk about allergies, and the same with medications, people will say, oh, I don't feel good after I eat it. I'm allergic to this. But what's the definition of a true food allergy?
So the true food allergy from a medical point of view or from allergy professional point of view is just one special reaction, like an immune response to the food protein after you eat the food.
Okay.
But in the public view, most people think whatever they feel uncomfortable, they feel that is food allergy.
Okay.
Actually, yeah. So it depends on who you ask.
But that's not really an allergy per se.
No.
That can be more of an intolerance.
Right.
So we're trying to discern the difference between intolerance and allergy. Right? And
Yeah.
that's a tough thing to figure out, I would think, in some instances, for patients at least,
Yes.
without seeing a medical provider.
Yeah, that is very, very important to differentiate true allergy versus food intolerance. Because true allergies, they can be very dangerous, can be very severe. You may have anaphylaxis. The even can be fatal.
Right.
But food intolerance, most time you just like most people feel like I'm gassing, bloating after eat food, or have heartburn, I eat a certain food. That is a food intolerance.
That's an intolerance.
Yeah.
Okay.
So we just shy away from that stuff then.
Right. So the most common one people say, oh, I have lactose intolerance.
Yeah.
Lactose intolerance probably most time it's not going to kill you. It's going to not. Yeah, like this kind of severe reaction.
Yeah.
You just
It causes
feel
a lot of gas and kill those around you, but it's not going to kill
But
you.
you can have very severe.
It's uncomfortable.
Yeah, definitely uncomfortable. Some people may have a bad diarrhea. Yeah,
Right,
so it's
right,
a serious issue, but definitely do not have immediate reaction like anaphylaxis.
Okay. And just for our audience, explain exactly what anaphylaxis is. I think many know, but many may not. So.
Okay, yeah, so anaphylaxis, that is one kind of most severe allergy reaction. Basically, you can have anaphylaxis to all kind of things, like a bee sting. Some people after bee sting, you pass out instantly, sometimes if severe enough, like penicillin allergy, people can have anaphylaxis. That means you can have rash, hives, your throat can closing, you can have coughing, wheezing, your blood pressure can drop. You can, you definitely can pass out. Yeah, this is kind of anaphylaxis.
And the blood pressure would drop because there's like dilation of the blood vessels with this. Correct?
That's right. Because when you have any allergy reaction, your body produces a lot of histamine. The histamine is a chemical inside your body. they will dilate your blood vessel, or they give you hives, give you itching. That is why we treat all the allergies with antihistamine, like
Okay.
Clarity, Zyrtec, these kind of things.
So histamine itself is a chemical that our body produces as a, I would say, maybe an inflammatory type of product, or
Yes, broadly you can call that inflammation, but the most this mediates release. When you have allergy, your allergy cells inside your body, there are one special cell called mast cells or basophils. Yeah, they release tons of histamine.
okay.
Yeah, that is why they give you itch, give you rash, give you hives.
So if you take something in that you are allergic to and you have a serious allergic reaction, anaphylaxis, as we're discussing, that's from part of that is an overwhelming release of these products that we would produce to a lesser degree for normal circumstances, but it gets a little out of control with an allergic reaction, correct?
That's right.
Serious allergic reaction.
That's depend how severe is your allergy. If your allergy is really severe, your body already produce a lot of antibodies against the thing you're allergic, like peanut allergy.
Right.
Yeah, you do not have peanut allergy first time. You definitely exposed to peanut allergy before you produce a lot of antibodies. When you expose to the peanut again, this peanut will react with that antibody. So there are active, a lot of allergy cells, like mast cells, basophils. They are like a cytokine storm, release tons of histamine and other mediators.
Okay.
Is it common for intolerances to become true food allergies? Like if I'm like just GI upset like every time, does that ever like lead to true allergies or not?
No,
usually?
because they completely different from different mechanisms to have the reaction. So intolerance is basically just for whatever reason your GI, most times your GI system is very sensitive.
Right.
Yeah, like people with some irritable bowel disease or something, they cannot tolerate a lot of food. They have to be very careful with their food. But that is not an immunological reaction. You normally don't have this dangerous allergy reaction.
Let me go back to the food allergy again, because peanut allergies we hear about all the time, and that can be obviously quite severe, and people can be exposed to really minimal amounts of the product and die if they have a severe allergic reaction. Why is peanut allergy such a bad player, so to speak? It seems like it's so severe in some people.
Yeah, so both nuts allergy, particularly peanut allergy and the seafood allergy, they can be very severe. We still don't know why they so severe reaction. One explanation probably is because the peanut protein is more allergenic.
Okay.
That means they're more easy to trigger your body to produce this kind of allergy kind of chain reaction.
Okay.
Yeah, and also it's very popular. We expose more. Most allergy you just develop that. You do not born with that because you keep exposing to that food, you will develop the allergy.
Yeah, and that's an important point, I think, because a lot of patients I see who develop what I think is an allergy, they always tell me, well, I'm 45 years old. I've never had a problem before. I can't have an allergy. But indeed, the more you're exposed to something over a period of time, the more chance you can develop an allergic reaction to it, correct?
Yeah. The first, you need exposing to the food. Second, your body changes. Your immune system changes with age.
Right.
Yeah.
That makes sense.
Right, yeah. So for most adults, the food allergy is nuts or seafood.
Right.
Yeah.
Right.
For the young kids, the most time the food allergy is milk, eggs, this kind of things. So that's a lot of people do. They eat seafood all the whole of their life. Suddenly they cannot eat that.
Isn't that cruel? You get used to lobster and you love it, and then all of a sudden at 45,
Painful.
no more lobster for you.
It'll save you a lot of money, though, really. I mean, lobster's really pricey nowadays. So.
I guess that's the one upside, I guess.
So I guess if I'm trying to simplify this for the audience out there, they can think of food allergy as it's an allergic reaction similar to what you would get with an allergy to a medicine.
Yes.
Right?
Yeah.
But an intolerance is different. That's just you have a physiological response. It isn't positive. You don't feel good. Maybe your stomach hurts a little bit, but you're not having that allergic reaction, which can include, in the worst case scenario, tightness in the throat, difficulty breathing, wheezing, low blood pressure, and even death in some instances.
Yeah, that is most severe form. Yeah, most allergy reaction, if that is really allergy reaction, you 80% time you have rash, you have hives, something like that. You feel itchy. And they develop very quickly. Within 30 minutes, most of the time, maximum 2 hours, you will have a reaction. But food intolerance, sometimes you can wait till next day. You eat dinner with red meat or something, next morning you start to have symptoms. They can be, and most food intolerance, you do not have rash, you do not have hives.
And it gets worse, potentially. You have to be careful, correct?
right?
Yes, they can
The
get
more you're
worse.
exposed. Because I have patients who
Why?
come in and they say, well, when I have seafood, I get itchy and I get a little rash and I feel something in the back of my throat. And I say, you have to stay away from it. But they say, yeah, but I've been doing it for years and I can work through it. But that could be next
That
time
can be
could
danger.
really bad.
Right. You did not have anaphylaxis today, and yes, it does not mean tomorrow you won't. Yeah. They,
My husband, who is a very smart man, decided to experiment with his almond allergy. Just exactly what you said. He's like, oh, I'm going to just see like if it's like quantity related or different types of almonds. So he's doing like all these side experiments and coming up President Ave to go to the hospital with an anaphylactic reaction.
Did he
I'm
have
like,
an anaphylactic
Definitely.
reaction?
he ended up in the ER. So I mean, the story from that is don't experiment.
yeah,
you know,
because your threshold get lower.
Yes.
With keep exposing. Yeah.
Yeah, so that's bad.
If you want to develop a tolerance, they do have the way to treat it, as they call desensitization, particularly for peanuts, for milk, for eggs. No, you can.
But you have to do that in a controlled type of environment, very low doses to start, not taking a
Not
handful of
yourself
almonds.
experiments.
Very,
on
very
almonds
time
today.
consuming, very expensive, and does not last. Even after a year or two, you be desensitized. You have to eat the food every day. If you stop eating the food for 4 to 6 weeks, you lose everything. You need to
Really?
start over.
Oh,
Yeah.
I
That's
didn't know
interesting.
that.
Because that is only temporary tolerance.
Okay.
That's not like permanent. Yeah.
Huh.
But if you continue to eat it on a regular basis, will that tolerance continue?
Yes.
Okay,
Yeah.
that's good.
That's why you use the food like people with severe peanut allergy. They exposed to very trace amount. They can have anaphylaxis. So they're very dangerous for them. So they will go through the food desensitization for peanut. They will use peanut as tablets as their medicine every day to prevent they have anaphylaxis.
Can those people with peanut allergies ever go out to eat? I mean, I know, like, this is not does not
scary, I
include
would think.
peanuts, but
'Cause
there's
it's
so
in a
many
lo- yeah,
cross contamination.
there's a lot of cross-contamination.
Yeah, that is why in the past few years they do require for peanut-free classroom, peanut-free school or something like that. Right now looks like the series changed. It's not fair for the people without peanut allergy. So the new series is for the young kids. The earlier or more exposed, you have less chance to have allergy.
Yeah.
So that's why right now still debating. And the airlines, some airline already stopped providers.
Most don't. I don't see peanuts anymore in airlines. It seems to be.
No,
no.
yeah, I think so. I'm getting a rotten bag of pretzels.
But you know what? If it's going to save someone's life, I'm okay with that.
Yeah, me
I think we
too.
can survive. Without some peanuts for a flight, right?
Yes.
I have a question then.
Sure.
Like, if you have an allergy to almonds, how come you can still eat some tree nuts? Just like almonds and peaches, maybe will be your thing you can't go near.
So all the nuts, tree nuts, they are specific. They do have some cross-reactivity, but not if you're allergic to almond, you probably okay with walnuts, with pistachio or cashew nuts.
Right.
Yeah. Because the different protein, the protein structure is different.
Oh, that makes
That's
sense.
why, yeah.
That makes sense. I can never figure that out, though, because John can eat every other kind of nut, just not almonds, and he can't eat peaches, but everything else.
Yeah, differences in the protein, even though they're related. Makes sense.
Yeah.
Makes
Yeah.
sense.
Yeah.
Yeah. No, does he have an EpiPen?
He does have EpiPen that his wife checks the date on every day because I'm like, John, this is 8 years outdated. It's not going to do you much good.
It's an important point. I'm sure he knows this as a nurse, and you know this, but if he has to use it, he has to go to the hospital because it wears off.
Right.
And a lot of patients forget that, right?
Yes.
They take it, they feel a little bit better. I'm okay, they stay at home, but then it comes back.
Well, I was just going to ask you about
Yeah.
that, too.
Tell us about that. Is that
And, like, what should we keep in our medicine cabinet?
That is a
little bit of Benadryl?
standard recommendation. If you have the symptoms, you question about about should I use EpiPen, you should use that.
Right.
Anytime when you question about that, yeah. So you rather overuse, you don't want delay the use because the EpiPen only lasts for like 5 minutes, the epinephrine, like 5 minutes.
So let me ask you something too, because some people live like out in Westport in the boondocks or something. It might take an ambulance 10 minutes to get to them if they live in these.
Like Little
But
Compton
some
now,
of
that's a
those-
different.
Okay, so let's just say Little Compton then.
All right,
and so you
You could be way out in Westport too. You're right. It
take
could be 20 minutes to get to the
You
hospital.
take EpiPen or something.
Right.
Are you taking like anything, like if you have Benadryl,
Yes.
are you taking that as
You
well?
can use that, yeah. But to be clear, Benadryl never can stop the anaphylaxis.
Okay.
Yeah, so right now the new EpiPen use actually plan, they already removed the Benadryl from the plan because a lot of people hesitate to use EpiPen. They feel like that's invasive, they don't know what happened after they use that big gun there, so they rather use Benadryl, they delay the use EpiPen.
So if someone feels they need it for whatever reason, they're having an allergic reaction and they just feel that this is something bad going on, they feel anxious or their throat's tight or whatever it may be, and they use the EpiPen, the next thing they should do is call 911.
911, yes, definitely.
And then they should have a second EpiPen in case it recurs before they get
Yes,
there.
they're always order as a 3-pack.
Right.
That is why you need the 2, just in case you have another episode.
So I have a question for you, doctors.
Yeah.
When you're writing out these prescriptions for EpiPen, like it always bothered me, like if John's out in his truck, like if we want to go to some fair out in Timbuktu,
Right.
you know, like, but I want to keep one in the house too, but I want to keep like one in the truck and one in the house. Do you get prescriptions, like multiple prescriptions, so you can
Well,
do that?
most of them come in a 2-pack that I've seen. That's
Yeah, you
just
can
keep
get
one
a
and you
multiple
just-
pack. Yeah, to correct you, never leave your EpiPen in the trunk
Oh, I know.
because outside in the winter is too cold, in the summer is too hot. They will destroy the medicine.
Okay.
Yeah, so always keep that inside your purse or your pocket. Anywhere you go, you have your EpiPen.
There you go.
Okay.
But you should have more than one.
I'm so glad that you're on our show because you could have just saved my husband's life. Thank you.
I think the bigger issue with him is he's challenging himself with
Well,
almonds.
not anymore. We had a little discussion about that. That was years ago.
That is a teenager's behavior, right?
Right?
A lot they risk
Exactly.
that. Yeah.
Exactly. I'm going to highlight that in our show notes.
There you go.
See this, honey?
Perfect.
Teenager. So, can we talk about the testing to decide if you have a true food allergy and like what types of tests are available?
Yeah, so they do have standard tests we have is like first like a skin testing, like
Skin testing,
skin-
okay.
Yeah, prick test. Yeah, it's very simple. It just with the food allergy extracts, we do have that available for all kind of food from the company. We buy that. You drop a small drop on your skin. Use a plastic prick, just prick on there. Within 15 minutes, if you do allergy to something, they will have the redness, swelling, looks like hives.
Okay.
Yeah. If you do not have the, you not sensitive, not allergic to that, there will be negative. You just see maybe very small red dots. That's
Do most
one
people
test.
know what they're allergic to, or do you just like use the arm as a pincushion and do like 20 injections? Like, what's the usual amount of?
No, so there here is a very common issue. Patient coming, I don't know what I'm allergic to. I just want to test. I don't want to make sure I'm not allergic to anything. I want to test for everything. So the everything that means we have 78 different food on our panel.
78?
Holy
78.
moly.
Yeah.
That's
so
2 arms.
That's a lot.
yes, yeah. So the problems is the food allergy test, either skin test or the blood test we talk next. They're not that perfect. They with the test is positive. They only tell you 50% chance you may allergic to the food. It's 50-50. You just roll the dice. Yeah. So if that is negative, that's really good. So there's 90% chance you do not have allergy if the test is negative.
Okay.
Yeah. So if you still question about that, we do skin test and do blood. If both negative, definitely 90%. You're not
Do a skin test, and what was the second one?
blood test.
Oh, blood test. Okay.
Yeah, you don't have to do both. If you, so that's why we normally recommend a patient never ask your doctor order the allergy test for you if you do not have any problem with the food.
Right.
Yeah, you don't do the screening. Yeah, because when they come out, they can be positive, can be negative. If you never eat the food, you're stuck there.
Right.
Because you have 50% chance you may have allergy. You never eat the food. Now what do? Your first choice probably I don't eat the food.
Yeah.
So for adult probably is fine. For the kids, there will be bigger trouble. They need the nutrition. They need to eat everything.
Right.
Now,
right.
yeah. So if you did a 78 food, 30 food come back is positive. What are you going to do?
My God.
You're stuck there.
Right.
Right.
I don't want to get away from food allergies. I know that we can spend a lot of time on this, but
Yeah.
I got away a long time ago from ordering blood tests for environmental allergies because they were all positive.
Yeah.
You would do it. They're allergic to 25 different items in the environment. This tree, this grass, this that. So I think that sometimes there's a lot of false positivity with those tests. Is that correct or am I
For
wrong?
the environmental allergy, normally that will be fine because that's not affect your nutrition.
Okay.
So if other the medications, they just treat the allergy in general.
Right.
There is no medicine for birch tree,
Right.
another
It's
medicine for
avoidance and
so does not matter.
antihistamines.
Yeah. So only difference we'll make is when you decide to do allergy immunotherapy, like allergy shots.
Right. Okay.
When your allergy is so bad, you need to do allergy shot. You need to know all the positives.
Right.
Yeah, when you do the shot, you don't put everything in there. Because each group of trees, they do have cross-reactivity. We just pick up one as a representative for the allergy shot.
That's kind of how I think about it. It never really seemed to make a lot of sense to do environmental allergy testing because really, what are we going to do? We're going to give antihistamines, unless you're going to be desensitized, I guess. You're going to give antihistamines. You're going to tell them to avoid this or that. I mean, sometimes it's hard if it's like tree pollen and that. It's just everywhere. But
Yes.
yeah.
So do have some significance. So if you do have a pollen allergy, like a tree pollen allergy in the spring, summer in the grass pollen, at least you know what you're allergic to. And then you can keep your window closed.
Right.
Do not open your window. Even in the summer, use air
It's avoidance, yeah.
Right. At least at your home, you don't have pollen. If you keep your window open, all the pollen come in, you do not have any environment free of allergies.
Right.
Yes, that is like animal allergy if you do have pets. Also, like some people, they want get a pet, but they have a severe cat allergy.
Right.
Probably it's not a good idea to get the cat into your house.
And I have patients who have cats and dogs and have severe allergies, and they suffer through it because they love their animals so much. But
This
boy, that's a
treatment,
tough
that
thing.
is, the treatment result is very good, 80% effective.
Really?
Yes.
Wow.
With desensitization.
Desensitization, yes.
So that's a situation where it makes a lot of sense.
Yes.
You have a pet that you love. You don't want to obviously get rid of the pet. You get desensitized. Yeah.
Yeah.
So, okay, back to food allergies. Go ahead, Nancy. You must have some more questions.
So I do have some more questions. I just wanted to, I had written down a question I want to ask you first. So when we were just going back to my husband, how come he develops that allergy later in life? How come you're 45 or 50 sometimes when you get allergies? Is it what you said previously, that you're just kind of
Exposed more.
Yeah.
exposed? That's it? That
That's
you just, it's just life?
Yeah, like any disease, you develop the disease, right?
Yeah.
Particularly our immune system, due with the age, you do change. Sometimes your immune system does not cooperate well enough. So like you produce like autoimmunity or something. As an example, like a lot of people in the middle-aged female have thyroid problems, because of Hashimoto disease, these kind of things.
Mm-hmm.
Yeah, the similar thing. People with autoimmunity more intended to have allergies. Yeah,
Okay.
with people explain that it could be because that part, because they do have type 1, type 2 immunity. Type 1 is for the bacterial infections to affect the bacteria. Type 2 is allergies. If this type 1, type 2 is imbalanced, you will develop the allergies.
So you said patients who have autoimmune processes have a higher
More
incidence
easy to have allergies.
because it's really a dysregulation of the immune system.
Right. There is a name called that is immune dysregulation syndrome.
Right.
Yes, there is ICD code for that. Dysregulation. Yes,
Do allergies run in families?
definitely.
Really? I thought
Yeah.
you were going to say no for sure.
No, they don't run in family. That is why some family did not understand this well enough. They have one sibling have allergy. They assume another kids will have allergy. They do not let the kids eat any food this kid allergic to. Yeah, we have the patients. Now is 70, 80. They want to go to army or go to military. But they ask their question, do you have peanut allergy or tree nut allergy? Some said, I don't. Some said, I don't know. If you answer, I don't know, they will send you come to us,
Yes.
test you. So there is one kid, college kid, his test was strong positive, but he never eat the food. So he stuck, but he still wanted, he rather take the 50% chance to have anaphylaxis one to the food challenge. The test
boy.
positive is fine, as we just said, only 50-50.
Right.
Positive does not mean you really have food allergy. So for him, it's very important. I give him the letter that he passed the food challenge, so he can go to the military. So he did that. He challenges peanut, almond, pistachio.
And he was fine.
He was fine. He was so happy. He said we changed his life.
So if you
Yeah.
so if you challenge someone and it's negative, then they don't have the allergy. But if you excuse me, are there any false positives, or is it probably not?
They do have false positives, but for him, he's not just the skin test was positive. His blood test was strong positive too. So we call that sensitization. So you sensitized, you will have much higher chance to develop true food allergy if you do not eat the food in the future. But if you eat the food before and now so you did not have any problem. Now you have positive test. You should continue to enjoy the food. If you stop eating the food, you may develop a real food allergy in the kitchen.
You know, too, like as a mom, it's tough to cook like 3 different dinners, right? So you're just gonna like with John, I don't bring any almond products into the house. I mean, that's
Yeah,
just
that is
don't
the
do
safest
it.
way to do that. But like the example I just gave you, my patient, he have few patients like that. There is another girl, she had a similar problem because for whatever reason, the daycare, I don't know why they went to the daycare, they get the record said, oh, she has a peanut allergy. She said, I eat peanut all the time. But the recreation organization, they don't take that. They want she to come here for the food challenge.
Okay.
So luckily we did the test. She was negative. So I said, I'll just give you a letter. You don't need a challenge. Your test, you tell me you eat the food every day, almost
That's
every
its own
day.
challenge right there.
Right, you already challenge it before I do a test, and your test is negative.
Right.
Yeah. So they still did not take that.
Oh, really?
Yeah. So she came back. We just do a challenge. Just
Surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. Primacare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. Primacare is large enough to take care of all your medical needs, but small enough to
You know, allergies, food allergies, I just think they're so tricky because, like, if you go to a potluck or if you go to, like, a Christmas
You don't know what's in
party,
food, what
and you
people have
don't, like I
cooked,
said,
right?
like the other day I was using my chopper, I just rinsed it, but I had chopped up peanuts, but I don't have to, like, no one has a peanut allergy, so I wasn't worried about it, but I didn't, like, throw it in the dishwasher and sterilize it. I rinsed it in the sink, you know? So, like, you don't know what you're getting.
yeah. So that is one of the reasons some people want to do the peanut desensitization, because it affects their social life. Basically,
Right.
Yeah.
You go to a restaurant, you don't know what they're doing
Right.
in the kitchen.
Yeah.
Right.
They could be, using a utensil that was exposed to
Right.
peanut. It could just be a little peanut dust on it, and that's
Right.
enough.
Yeah, so for this kind of population, they normally decide to do the food desensitization because once they desensitize, they just take one peanut. That is more than enough for cross-contamination. So they know they can eat a peanut. So they go to the party as long as they do not eat the peanut itself. They don't worry about other cross-contamination.
Okay.
So they were more relaxed.
So when you talk about desensitizing, like, how does that work? So say I have a small child and I'm like, oh, I don't want him to go through life with a peanut allergy. Can you walk me through how that happens?
So for the peanut, the desensitization, you mean they have allergy, yeah. So basically they give very tiny amount, 0.0 some milligram, very tiny amounts, systemically, double the dose. It's the first day you will stay here for a whole day. So basically they give you double each step, 20 minutes, every 20 minutes, double, until you can tolerate like 3 milligram or something like that, and then you go home, you continue to enjoy this same dose for a week or 2, you come back, we will double the dose again, watch you close. If you have a reaction, we'll treat you. So we know you may have reaction because you're allergic to that. And then they treat your allergy reaction. So they give you food, continue, like the drug desensitization, same principle. So within a week or 2, your body immune system will work out, tolerate this low dose. And next time you come here, we will increase again. So this is, by the end, you will tolerate a certain amount.
And then you're set for life.
Not for life.
You don't have to worry about it.
As long as you continue to eat the food.
Okay.
Yeah.
All right.
Yeah.
What do you do in a scenario where a mother or a father has an allergy to a particular food, and now they have a child in the home who's never been exposed to it? Should they avoid that completely, or can they try it out and see how it goes?
They should not. Otherwise, they will create another teenager like my patient.
Okay.
He was in my clinic probably for 2 months, almost every week.
Okay.
Yeah. It's a very, very time consuming. Each food challenge takes more about 3 hours. And very expensive. Yeah.
And maybe you don't have an answer to this, but don't say anything. I got a protein shake the other day, and I just forgot there were almonds in it, and I was very excited. It was a blueberry one, and it was delicious. I'm like, oh, John, try this. It's really good. And he took a big gulp of it, and then he's like, there wasn't almonds in this, was it? And I was like, oh, there was. So what's the safe zone? Like, if you eat something and you're like, oh, my God, there was, like, you find out later that your bad food was in there.
Like how many hours do you know you're out of
yeah,
the window of
is it like, okay,
hours.
10 minutes or 20 minutes? What was it?
They happens within first 30 minutes.
30 minutes.
If that is enough protein you're exposed to, if you have reaction,
Okay.
very quick. But within 2 hours, still is the risk period.
Yeah, I felt hard.
That would give
You're
you
not
enough
supposed
time
to go
call
to
your life
anywhere.
insurance agent and
I felt so bad. I was like watching him, you know, feel like
guy.
I know, right?
Yeah, if you have that kind of accidental exposure, definitely do not go to a woods, take a hiking, something. Do not do that. Yeah, stay home.
You'd
Yeah,
cover for me though, right?
yeah.
Like,
Oh my
Lucas,
God.
what do I do? So, can we talk about breastfeeding moms and allergies and how you discuss topics with them?
Yeah, that is another big topic. So in the past, like 10 years ago, we always recommend the mom don't eat that, don't eat this if you don't want the kids get allergy, even during the pregnancy. Yeah. So now the theory is complete opposite. They said the sooner, the earlier you exposed to, you'll have less chance to the allergy.
Okay.
So they have several UK, America also have big clinical trials already done. They prove from 4 to 6 months, if you expose peanut, your to the chance to develop peanut allergy is significant, like more than 50% decrease compared with other avoiding the peanuts.
Okay, that's interesting. So, you know, even if someone in the family has a food allergy, it doesn't mean that a child can't be exposed to it. In fact, they probably should to reduce their risk of developing it
Right.
down the road. Okay, that's
Yeah, they should. Yes. Yeah. So they already they have a lot of studies show. So for the breastfeeding mother, if you avoid a lot of food, because some mother just worry about the peanut allergy, peanut butter egg allergy, so they don't eat anything. Compare that with another group, they eat everything. There's no difference. You do not lower the chance your kids develop allergy.
okay.
So, but if your kids already have peanut allergy, probably it's better. Yes, yeah. They don't.
So does breastfeeding in general reduce the chance of a child developing allergies as they're an adult, or does it not matter?
I don't know. There is a solid evidence. People promote for the breastfeeding definitely see that way. They do have a lot of other ways they say can prevent peanut allergy, like a probiotics or something like this. Yeah, there is no very good data to definitely to let the allergy societies recommend as a way to prevent allergy.
Okay.
Yeah.
What are the most common allergies? Like if you had to list like the 3 to 5,
talking about
like
food
most
allergies,
yeah.
or-
Yeah, the most common in general, most common six food is milk, eggs, nuts, seafood, soy.
Really, I wouldn't have put soy in that list. That surprises me.
Yeah, 6 common food, right? Oh, wheat.
Wheat.
Oh.
Yeah.
Yeah.
I can
So
see.
for the kids, young kids, most common one probably was the milk and the eggs. Adult, most common food allergy is seafood or nuts.
So with the baby formulas, like they're all pretty sensitive to allergies, or are they like?
The baby formula, most baby formula is coarse milk based. They just milk.
Okay.
Yeah. So they have to have the special formula for kids with milk intolerance in general, not necessarily the really allergic to milk. They just cannot tolerate the coarse milk protein. They were amino acid based, like Neocate or something like that.
That's weird. One of the twins had a milk intolerance, so we had to get her special formula when she was a baby. She doesn't have any kind of dairy intolerance now.
Really?
So yeah,
Normally after 12 months. Yeah, because your gut mucosa is more mature.
they were preemies too. So maybe that
Yes,
has
yeah, premium definitely. Yeah, you're not mature enough, so probably a lot of large protein particles can get into your like a peptide. Normally supposed just amino acid get into your blood. Now you have the bigger peptide. They is allergenic. They can trigger your immune response.
Okay. That's interesting.
Yep.
What's the correlation between introduction of solid food, or the concern, I guess, introduction of solid food with babies who have eczema?
So right now for baby with eczema or they have egg allergy, they more likely to develop peanut allergy, particularly. Yeah. So the way to do that is we call that high risk babies. You suppose introduce peanut butter as soon as possible, as early as 4 months.
Oh,
Yeah.
I didn't know there was any relationship. How come there's that relationship with eczema and the food allergies?
So eczema, basically, there is another name what I call leaking skin disease, something or dry skin.
Yeah.
Because your skin integrity is not good enough.
Right.
There is one theory. They said whatever allergies inside your environment can penetrate your skin, sensitize you, even you never eat the food. They do have, because eczema is like a Th2 kind of immune responses, it's kind of allergy conditions. When you have one allergic condition, you're more intended to have other allergic conditions. It's called atopic. Yeah, that is why it's more likely to have food allergy.
I know this is a little bit off topic with the food allergies, but do you treat patients just for eczema?
Yes, yeah. Because in our primary care, we don't have the dermatology. Most people with skin issues do come to me. Yes.
Great.
Yeah. And a lot of eczema, particularly the severe eczema, they definitely is allergy related, not just the food, even environment allergy, they can make that worse. Or some they may have chemical allergies, like your laundry detergents, your shampoo, your soap. Yeah, so they do come to do the patch test to find out which ingredient they're really allergic to can direct them to choose the correct product.
So if are you okay with me going off on a little eczema tangent?
Sure.
Yeah, go
So
ahead.
just broad strokes, because I know this could be a whole other podcast on eczema,
Yeah.
but it just seems like a lot of people I know have eczema these days. Like broad strokes with eczema, can you kind of like do's and don'ts kind of, and how you would direct someone, or is it very, very case independent?
Eczema is very heavily genetic orientated.
Okay.
If you do have a parents or sibling, particularly severe eczema, mild eczema, a lot of people can have that. For severe eczema, some people have lifelong eczema. We do have adult eczema, really, really bad. Yeah. So that is one. Another theory people believe we live in a environment too clean, over clean. We just use too many bactericide or something. You just killed all the bacteria, all the microorganisms. They sometimes these organisms live with us together. They probably can induce your Th1, the type 1 allergy reaction. But now you scroll and choose the Th2. That's why you have more. These kind of things. Yeah.
Is there like certain parts of the country that are better for people to live with eczema? Like, do they do better in dry climates versus like tropical climates, or is that just
Most of the people eczema getting worse in the winter because the skin is dry, more
Yeah.
flaky, more easy to break
Yeah.
down. Yeah.
Right.
That is why the treatment, one of the treatment component is the moisturizer. Hydration. They recommend you use moisturizer like 4 to 6 times a day.
Oh, wow.
Yeah, not people can do that. Sometimes like the children, the young kids.
Yeah.
The eczema is so bad, the whole body is red, is getting
Right.
infected. They have to get it admitted. We admit a lot of patients with severe eczema.
Yeah,
What do we
yeah.
do in the hospital? They be wrapped with the gauze, with the moisturizer, with the saline water.
Right.
To like a whole night overnight. They call wrapping therapy. Yeah, with zinc oxide or something like just keep their skin hydration. Yeah, and then give them use a lot of antihistamines
little
to stop
babies.
the itch. Yeah. Yeah,
So
the
uncomfortable.
good news right now they have very good injection medication for that. In the past, we only medication used as steroids,
Right.
topical steroids or oral steroids. But they have a lot of side effects. So now they have medication called Dupixent. Yeah,
I've had some patients on
Really
that. Really
effective.
bad eczema. It works really well.
Yes. Yeah.
Yeah.
Yeah, we have a lot of patients come in to do the injection for that. Yeah.
It works nicely.
So now, when someone does have an allergy and they know they have an allergy and they go to you and you do all these tests and things like that, how often should they keep on seeing you?
Depend on how severe is their condition. If they only have like a mild, what you call seasonal allergy or
Yeah.
fever, they probably see me once 6 months or even 12 months. Yeah, if they do not do allergy shots. Yeah, if they severe enough, like a food allergy, we normally see at least once a year. Particularly for the young kids,
Yeah.
want to catch up the moment, they may outgrow the allergy, like a milk allergy, egg allergy. Yeah, they can outgrow. Yeah.
Oh,
All right, well, here's an interesting question. Oral allergy syndrome versus food pollen allergy syndrome.
They are same.
The same thing?
Yeah, the same thing. They just a different name. Yeah.
Okay.
Yeah. So that is a condition for people with a lot of pollen allergy. For years, suddenly they cannot eat some fruit, vegetables, even nuts.
So it's pollen that's on the food source, or is it the same protein that kind of is a similar protein in the food?
Most likely similar protein structure, the cross-reactivity, but there is one theory people believe the pollen residue still on the skin because some people with the peel of the apple skin, they tolerate better. But most time when you eat the process, like heat, treated the fruit, like from the glass jar fruits, most people is fine. Or the vegetables, if you just eat the carrots, the raw carrots, you have a problem. But when you eat the cooked carrots, you have no problem. Yeah.
And then food-related exercise-induced anaphylaxis.
this was one that stumped me.
That
like
is
I
scary.
saw this
I've
and I
had
was like,
one
"What is
person
this?"
with that, and I don't remember what he was allergic with, but
is it?
whenever he had this particular food and he exercised, he would have, he had actually a couple
How
anaphylaxis.
does that happen?
Yeah, tell me about that, because I found it interesting. I didn't know much about it. I've only
had
had
to
one
read that
patient with it over
sentence,
the
like,
years,
5
but
times
Yeah,
over.
that is under the big name called exercise-induced anaphylaxis.
the reason
Some
not to
people running inside the woods, standing on the ground. Yeah. So food dependent. There is one kind of. Sometimes it's a medication. Like some people after they use ibuprofen, they run because they always exercise. They have pain, muscle pain. They use that. They start. Yeah, the food is a very special one. It's not that very common. Maybe 1 out of 10,000 people may have that condition.
Okay.
Yeah, most common food like wheat products,
Yeah.
seafood, any food can happen. Yeah.
Right.
Basically, when you eat the food, when you eat sometime after lunch, within 30 minutes, you decide to take a run, and then you have the problem.
Okay.
But if you just eat the food without exercise, or you did not eat that particular food, you do exercise, you will be fine. Yeah. So
it's very interesting.
Yes, so there is no good treatment for that. The only recommendation is you do not do the
exercise.
exercise within 2 to 4 hours
Of eating the food.
after you eat that particular food.
Okay.
Or exercise before, but you still have all the stuff in your blood, I guess, to react with the food.
Yeah, they said within 2 to 4 hours, you just eat the food, it keep absorbing into your blood, and there when you do the exercise. Yeah, there is one theory said the exercise, when you do the exercise, your whole body is like acting out, right? The bloodstream is move fast, so they thought you absorb more easily with the food protein particles. Normally, the particles will stay inside your gut until complete digestion. Now, they very easy to skip your gut, get into the bloodstream.
Okay.
So they trigger your immune response.
Dr. Zhou, is that like for strenuous exercise, or is that like for Nancy exercise, like going on a walk? Like, I thought, like
most
an exercise warrior.
like people running.
Okay, so it has to be like you're sweating.
Yes, probably have to have some sweating. Definitely you, you.
Not for my strolls.
Yeah, because the happy is for people hiking. Happy is people just do run on the treadmill.
Right.
Yeah, the happy. Yeah.
Okay.
Okay.
Well, we're actually running out of time, but I do have one question I got to throw out there. This could be a whole talk, so I don't expect you to answer this completely. But there's so much celiac disease now in our society, which is, of course, an allergic type of issue. Why? Why is there so much celiac disease?
Because the celiac disease also is kind of autoimmunity.
Mm-hmm.
Yeah, just because your body system just dysregulated.
Right.
I don't know why they had more, because I know a lot of people do that they cannot tolerate the wheat.
Right.
It's not everybody do have real celiac disease.
Right. So it's the whole thing of intolerance versus allergy once again.
Yeah.
But I wonder if we're just recognizing it more too. That
Yes.
might be part of it.
Because we pay more attention to that. And a lot of people do think the wheat product is not healthy for you. They consider that is a inflammatory food.
Right.
Right.
Yeah.
Right.
Because when they eat the bread, eat the pasta, they feel bloating or something like that. Yeah. This feels like that's inflammation.
Oh.
So
Inflammation is the enemy.
right.
That's right.
Yes. Yeah.
It causes a lot of problems. Increased cancer risk, heart disease, you name it. Right?
Inflammation's bad.
Inflammation's bad. So anyway, this was great.
So
Is there
informative.
any one message you want to leave the audience as we come to a close today?
Okay. Yeah. I can go back to the allergy testing.
Okay.
Yeah. So we just talk about the skin test. Also, blood test also, you can do blood tests. We normally do not do blood test because blood test is not a direct. When you do the skin test, you see the redness, you see the swelling direct on your skin, very quick, very simple.
Okay.
Yeah, blood test, sometimes you need to wait 1 or 2 weeks. We normally do the blood test is only when your skin condition is not. Some people with condition called dermatographies. Like a patient come in, we do the skin testing, everything blow up, including the water, the saline, negative control the red. So you cannot read that result.
Right.
Yes. Or some patients cannot stop the allergy medicine, like clarity, certain antihistamine. There's too much itching. When you do the skin test, you have to stop the medicine for 4 days.
Oh.
Yeah.
Okay.
Yeah. So that is something you need through there. I would like the audience to know to never do the food allergy screening test. Otherwise, you are going to get into the very difficult situation. Yeah.
You're talking about the blood testing?
Whatever, blood test or skin
Okay.
test. If you do not have any problem with the food, you just, I may have food allergy. I need to do the screening test. Never do that.
So you're only doing it if there's a specific concern, not necessarily
Right.
someone. If someone comes in and says, "Hey, I just want to get tested for all these items to see what I'm allergic to," that's not a good thing.
That is not a good idea.
Because you get false
Yeah,
positives.
if
and
they're all
whatnot.
negative, that is great. You realize, I don't have allergy. I have a, yeah. If they have a lot of positives, but you eat the food, you never have a problem. You're
Right.
stuck there.
Yeah.
Mentally, you were scared to eat the food. Actually, you
yeah,
don't have
I would
food
be.
allergy. Yeah.
Right.
Yeah.
That's great advice. I guess the other thing would be for the patients who do have what we would consider anaphylaxis. They have to immediately react to that.
Right. They have to go call the 911. They need to go to the emergency room. Yes. Yeah.
Okay.
Okay.
That's great advice.
I think so.
Yeah.
Everything was great.
All right.
Thank you.
Well, thank you. And if our audience wants to contact you, they can get in touch with you through Primacare.
Yeah, our website with all our phone numbers.
Okay.
And contact information.
I think we can post that too, I'm sure.
Yeah.
All right,
Yeah.
great. Well, Dr. Zhou, thank you so much for being part of our show. I think we all learned a lot. It was really interesting, and we could go on and on about a variety of allergy issues, and maybe we'll have a part 2 down the road. But at this point, I'd like to thank all of you for listening to our show. If you'd like to become a sponsor, please contact us at 774-319-4230. Special thanks to Ron Gamache for our intro music. Primacare, your trusted medical providers in southeastern New England, and BioSkills of Northeast for producing our show. And Available produce your show by calling 774-357-0513. Bay Coast Bank, just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. Duncan Hearing Healthcare you can trust, with sites in Fall River, Dartmouth, Falmouth, and Centerville. For more information, visit their website, duncanhearing.com. Once again, thank you, everyone. Have a great day, and we'll see you down the road.